Ladies and gentlemen, good evening, and thank you again for joining us for another COVID-19 press briefing. This evening, we welcome the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Letitia Lestrade-Wyke, the National Epidemiologist, Dr. Shaluddin Ahmed, Infection Control Officer at the Dominica China Friendship Hospital, Joanna Laurent Blaise, the Health Coordinator with the East Caribbean Conference of Seventh-day Adventists, Priscilla Prevost, and the Director of the Dominica Social Security, Janice Jean-Jacques. We welcome all those of you tuned in via the various media, and also, of course, to the diaspora who are also tuned in to the press briefings. We'll begin this evening's presentation with the Infection Control Officer, Joanna Laurent Blaise.
Good evening. I acknowledge the presence of the Minister of Health and Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade-Wyke, National Epidemiologist, Dr. Ahmed, Health Promotion Coordinator, the Adventist Coordinator of East Caribbean Conference of Seventh-day Adventists, Mrs. Priscilla Prevost, Director of Dominica Social Security, Ms. Janice Jean-Jacques. To the media, to the listening public, good evening. I am here this evening to re-emphasize on the infection prevention control measures of COVID-19 as was demonstrated at the pre-preparation phase and during the pandemic phase. May I say to each of you, the healthcare worker, specifically to those of you who are still at the hand and giving care to COVID patients, I want to thank you for going the extra mile in such a time like this. Many effort and time was placed in the preparation as a health team, which incidentally started way before January 2020. It begins in the early 1980s with the persons like Dr. Clarissa Etienne, a pioneer in the primary health care. As known to all Dominicans, primary health care back then led the way in the entire region. So too, this evening, I stand before you, the general public of Dominica, and say that the Ministry of Health and Wellness and New Health Investment has proven to you that primary health care is still dynamic and has demonstrated its commitments to you, the people of Dominica. I have listened to the many media personnel who posed this question, such as Mr. Steve, Prosper, Oprah from Kyrie, Matt from Q, Matthew, and Stephen D from DBS. And they often ask, what has contributed to such success thus far? May I say to you, all the answers given were indeed correct. And let's not forget the Almighty Father, who is ever present and knows why and how things will turn out. But permit me to add, it's the effort of hard-working, vibrant, resilient healthcare workers, both at the primary healthcare and social level. The police officers, of whom my husband is part of, at the helm of the quarantine. The sacrifices of not always being there at all times for the family, duty calls, the custom fire officers, and also environmental health, and of course, the collaborative efforts of the Dominica people by extension. What has contributed to such success thus far? Please take note. There is a well-defined, established active surveillance system which is suited for diseases of special interest, such as COVID-19. This robust surveillance creates an avenue for early detection, such as unusual events as COVID-19. It allows this team to provide data to the magnitude, distribution, trends, according to time, place, and person, to include dissemination of information to be able to plan, prioritize, and acquisition of finance necessary to implement specific control activities. This active surveillance initially reached its full potential under the leadership of deceased Dr. Paul Ricketts, who was also known as one of the best brilliant national epidemiologists in the region, by extension, the world. One of the well-established mandates of the National Public Health Surveillance Research Team, thus far, of whom I am a member, I must say that Dr. Paul and Mr. Fortune must be smiling down at the Ministry of Health under the leadership of Dr. Irvin McIntyre and PS. Our retired workers such as Dr. Shalene Ford, Marva Smith, Antilia James, Mr. Prince, Sister Augustine, Desabey Julie, Dr. Elwin, Mrs. Shillingford, I must say that, of course, they were in the direct line of such work. May I permit to say what else contributed to this success in containing COVID-19 thus far? Of course, I must give high commendation to the frontline workers from the Infection Control Office. Our healthcare workers continue to show unwavering passion for the task ahead and willingness to serve their life and also to give their life online. From 2012 to present, the Infection Control Department continues to find innovative ways to celebrate and highlight World Health Organization theme, Save Lives, Clean Your Hands campaign each year. This is indeed a time to save life, as you have seen. Thanks to the support from Pan American Health Organization, headed back then by Mrs. Shirley Augustine, and the great effort of the staff of the Quality Department, headed by Mrs. Tamika Hogan. During the preparation phase, while we armed ourselves for battle, there were several in-service training sessions conducted for all levels of staff for the third week in January 2020. This included demonstration of donning, which means putting on your personal protective equipment, and doffing, which means removing. This aspect is critical in ensuring that our staff are well equipped and are able to demonstrate the skillful, effective service that they have served thus far. We continue to do tabletop exercises for domestic workers with the use of cleaning disinfecting guidelines established in August of 2015. The Ministry of Health and Wellness has always been in the forefront of ensuring that staff are equipped for such a time like this. This was headed and spearheaded by Ms. Judy Dura and validated by Ms. Felix at the Health Information Unit to ensure that refreshers were done for our cleaners. You ask again, what else contributed to such question in containment of COVID-19 thus far? The management team, by extension, support staff under the leadership of the heads at the Ministry of Health, Wellness, and New Health Investment. Over the years, the Ministry of Health, Wellness, and Health Investment, with support from Pan American Health Organization, has supported the activities of distributing hand hygiene posters over sinks in clinical areas, training of staff at hospital and district level in infection prevention control measures. Hence, our frontline workers are knowledgeable and know the importance of practicing such measures. We operate as a team. The CMS manager, Mrs. Jasmine Lambert, and Chief Pharmacist, Mrs. Anna Roy, and their continued staff continue to work tirelessly. Mrs. Fabian, Ms. Bopier, Dr. Blanc Matron, Dr. Paul Issa, Mr. Eric Carbon, Mr. Fontaine, Dr. Elwin, Dr. Monroe, and Dr. Mead continue to give support at the front line. Other staff, such as the maintenance, yardmen, orderlies, carpenters, IT, quality department, records and account staff, nurses, ward sisters, departmental sisters, and doctors, thus far has contributed to the cause of COVID in respect to the prevention of infection. There is also a robust infection control monitoring system which caters for various scenarios, and staff are aware of such mechanism which works. Critical path flows were put in place to ensure patient and staff safety. This, for example, upon entry, exit, and while on the wards. You may be well aware that, for example, If we have a patient for 2 to 5 days and, God forbid, they develop COVID on the ward, what do? Hence, the robust critical path flow were put in place. Tools were modified from Pan American Health Organization, WHO, for monitoring of staff in respect to signs and symptoms of COVID. Thank God, we are thus far free. Thanks to the doctors in charge of the different wards for protocols and plans, which were established and placed in algorithms by the Quality Department and Infection Control under directives of Dr. Blah. What else has contributed to such success thus far? And I say thus far. Please give me a listening ear. Many COVID posters were erected in respect to infection control at strategic locations at the hospital. This would catch the attention of the public. Also, we had hand hygiene posters from International Organization Migration, which assisted as well. Hundreds of leaflets distributed by the staff of the Accident and Emergency Department, Dialysis Unit, and Outpatient and the Operating Theater. The printing were much needed and came in much time, and thanks to Mr. Esprit and Yankee at the printery for developing this material. Educational sessions and demonstration of proper hand hygiene techniques were also done with the fire and ambulance department. We may say, why so many talk about hand hygiene? Permit me to say to you, the general public, effective hand hygiene is one of the single most important strategy in preventing the spread of any type of infection. In this case, it goes hand in hand with respiratory etiquette. I stop and request of you, the public, to join the frontline workers and the Ministry of Health, Wellness, New Health Investment in the efforts to practice good hand hygiene at the key moments when needed. Let me echo to you, my fellow Dominicans, some additional simple key messages you must also practice as I end. After the third use of hand sanitizer, please perform hand hygiene with soap and water. While hand sanitizer with 70% property is very effective in killing germs, an accumulation of sanitizer, especially if you use it over and over, you may sometimes feel that your hands are slimy. Then it is time to wash with soap and water. Always perform hand hygiene with soap and water if your hands are visible soiled. Example, when eating mangoes, it is time to wash and not to sanitize. It's preferable to use antimicrobial bar soap to wash your hands. However, please ensure that the surfaces on which the soap sits on is always dry. This reservoir can allow bacterial growth, hence the soap must always be dry. You have already been empowered by the Ministry of Health, by the Minister, the Permanent Secretary, Staff of Health Promotion, Head of Primary and Secondary Healthcare in the Ministry of Health, Wellness and New Investment. Keep taking the steps to protect yourself. Continue to practice proper hand hygiene, placing emphasis between the fingers, the thumb, and the fingertips. Call the hotline for if you are sick. Continue to avoid close contact with people. Continue to take steps to protect others. Stay at home if you are sick. And I say again, if you are sick. Go to the public, stop going to the public places, restroom, and other interaction at other establishments. You need to eat nutritious food. Increase intake. If possible, separate yourself from other family members by staying in a separate room. Make use of face masks always. Continue to put distance between yourself and others in your community, especially those of you who are at high risk. Those with cancer, sickle cell, high blood pressure, asthmatic, and the list goes on. Maintain your 2-meter or equivalent to 6 feet. Cover and cough in a tissue, dispose in a covered bin, and wash your hands. Continue to practice proper use of face mask. Clean and disinfect frequently touched areas. This is a picture of how your hands may look under a microscope. Germs are always on the hands. This is when you wash and do a proper hand hygiene, it is clean. Always measure your bleach. You may think that you are killing viruses and bacteria, but if the correct proportion is not used, then it will not be effective. Hence, if, for example, you are cleaning any body secretion, you would need to make a 1 in 10 solution. If you need to clean your washrooms, changing rooms during an outbreak as such as this, or diarrhea or vomiting, you need to make a 1 in 50 bleach solution. I end by saying, it is my hope that the public continue to bond with the healthcare workers. I see this as a new era, where hope is built and trust has been regained from the public with the healthcare workers. As healthcare workers, we have always had the health of the nation in our hearts, but you have it in your hands. Therefore, we ask of you from the Infection Control Department to do your best by adhering to all the health measures you have heard on a daily basis thus far. Yes, we have reached far. Yes, we have seen the light at the end of the tunnel. But in order to be a COVID-free society, it needs the commitment of each of you and me, of course. Like Mr. John Christian always say from the Health Promotion Unit, your health is your responsibility. I thank you.
Thank you very much, Nurse Blaise. Nurse Blaise and her team are not often heard about, but the work that they have been doing, not just now, but over the years, that's invaluable to the Ministry of Health. So thank you, Nurse Blaise and her team. I'm sure many of you would have heard already about the collaboration between the government of Dominica and the Dominica Social Security to provide support to Dominicans in this time. And that's why with us this evening, we have the director of the Dominica Social Security, Janice Jean-Jacques Thomas.
Thank you, Ms. Harry. Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment. Mrs. Letitia Lestrade-White, Permanent Secretary in the Ministry of Health, Wellness and New Health Investments. Dr. Ahmed, Acting National Epidemiologist. Mrs. Blaise, Infection Control Officer. Mrs. Priscilla Prevost, Health Coordinator of the Eastern Caribbean Conference of Seventh-day Adventists. Good evening. The Dominica Social Security Board, its management and staff commend the government of Dominica on its successful handling of the situation regarding the presence of the coronavirus in Dominica. As the National Insurance Program, the Dominica Social Security exists to provide income protection for insured persons and their dependents who suffer loss of earnings due to any of the several contingencies prescribed in the Social Security Act and regulations. Thus, when an insured person has been diagnosed with the virus and therefore has to abstain from work, such an insured person would qualify for the receipt of sickness benefit in keeping with existing provisions. Also, where someone has been medically required to be on quarantine or in isolation, the health authorities are required to inform the employer and the Dominica Social Security, so that such a person can be considered for the receipt of sickness benefit for the relevant period of isolation. In addition to the above two situations, there has been widespread concern regarding the plight of insured persons who may be temporarily unemployed or underemployed by virtue of the fact that they have been laid off or are on reduced work hours or work days, and possible ways of cushioning the impact of the pandemic on their earnings. The Dominica Social Security, as the major pillar of Dominica's social protection mechanism, unlike almost all other social security systems within CARICOM, felt it necessary to take action to recommend a measure that would provide a level of income relief to insured persons who have been displaced from work as a result of the disruption in business due to the coronavirus. The International Labour Organization was consulted on possible measures which could be adopted at this time to provide social protection to workers. The recommendations included consideration for the introduction of an emergency unemployment benefit. Meanwhile, the firm of Mono Chappelle, in a special bulletin on COVID-19 for Caribbean Social Security institutions, advised, if you do not yet have an unemployment benefit, it is possible and feasible to introduce one during a recession without prior funding or additional contributions. Thus, with the assistance of an actuary from the firm of Mono Chappelle, the Dominica Social Security received support and advice on how this could be accomplished without jeopardizing the sustainability of the fund. The proposal was to utilize part of the reserves in the redundancy fund, which was established under the Protection of Employment Act and being administered by the Dominica Social Security on behalf of the Ministry of Labor, and part of the reserves of the Employment Injury Branch of the Social Security to offer income support in the form of a temporary unemployment assistance benefit. I must say that this benefit is one of the benefits that is recommended by the International Labour Organization for a basic social security program. We do not yet have an unemployment benefit in Dominica. So the proposal was discussed among management and staff at the Dominica Social Security, after which it was taken to the board for its consideration and adoption. Thereafter, the proposal was forwarded to the Honorable Prime Minister, who, upon receipt, advised that the Dominica Social Security consults with the private sector organizations to apprise them of its intentions and to report back to him. Consequently, the Dominica Social Security management, senior management, held meetings with the Dominica Employers Federation, the Dominica Hotel and Tourism Association, and the Dominica Association of Industry and Commerce, whereupon they all pledged their support for the initiative. On that basis, a report was then submitted to the Honorable Prime Minister and Minister for Finance for approval of the special facility. At this juncture, we are awaiting communication on the way forward and passage of the required legislative provisions to give effect to the initiative. The Dominica Social Security is confident that the implementation of this initiative would serve to relieve the plight of affected workers, while also assisting in the stimulation of economic activity by virtue of this injection of funds into the economy. such action would simultaneously yield benefits to the social security system, since employees within certain sectors could continue to be employed, thereby generating spin-offs for social security through the continued payment of contributions at a time when there would otherwise be a downturn in contributions income. So we anticipate the approval of those measures so that the employees who are already affected can receive some level of income protection. I thank you for your attention.
And these, of course, are very unusual times, so we thank the Dominica Social Security for their promptness and their willingness to come on board and provide the necessary support to Dominicans. Of course, we have to wait a little bit with these things. These things take a little bit of time, so on their behalf, I thank you all for your patience as they try and navigate through these waters. Our next presenter this evening is Priscilla Prevost, who is the health coordinator for the East Caribbean Conference of Seventh-day Adventists. Of course, we all know her as Nurse Prevost. She wears several hats, and she will be doing the next address.
Protocol having been established, a pleasant good evening to everyone. At the stakeholders, let me first thank the Minister of Health, Honorable Dr. McIntyre, for inviting me to be part of this press briefing this evening. At the stakeholders consultation held on March 13th, I recall stating that to successfully deal with COVID-19 pandemic, it required an all of government and all of society approach. Today, 6 weeks later, I applaud the manner in which both the preparedness and the response has been and is being managed. We commend, and when I say we, the East Caribbean Conference of Seventh-day Adventists, who I represent here tonight, we commend the government for all of the approach, for the all-of-government approach that have been implemented and is being implemented here. We commend the private sector for the initiatives taken. I recall when I went to a certain business place and I saw pipe with sink and soap to wash hands and all the things that the managers of the business places have instituted, we say thanks much. We also commend the churches who have complied and have serviced the members or the membership through online platforms of various types. I know we have the Zoom, and we do Zoom church, and we have streaming, church being streamed. So while we are not together physically, but church is still going on, and we thank God for that. We also thank or commend the public for adhering and complying to social distancing and curfew guidelines. Today, we can say that it has really paid off. We understand that there is no progress without sacrifice. We have to suffer some sort of inconvenience for the good of all, and the public have and must be commended. When we listen to some of the stories of persons who have been affected or infected, we understand that it doesn't take much for a family, an entire workplace, a church or community to get infected as a result of having one infected person around. It is for this reason that non-essential workers are asked to stay home and that the workplace have been closed. And as I said earlier, churches or church buildings are closed. Not the churches, because church is ongoing every weekend, Saturdays and Sundays. We truly appreciate the fact that we understand the reason. When we understand those facts, those things, we understand the reasons why these places have to be under lockdown, especially on a weekend. Because on weekends, we have a lot of congregating. People gather at churches, at bars, on the beaches, and in places where social distancing sometimes is not possible. And therefore, the reason for having the lockdown on weekends. We appreciate that. Tonight, I wish to submit to us that God heals. He placed in our body the immune system, a very intricate system through which he works to bring about healing. Being placed in an environment that is supportive with loving and caring staff, our COVID-19 patients have made significant progress while at the same time keeping their family and their community safe. We give God thanks. God heals, sometimes in strange ways, ways that might seem to us as unusual. In 2 Kings chapter 5, verses 1 to 14, Naaman, who was sick with leprosy, was asked to go and dip 7 times in the Jordan River. The Jordan River, according to Naaman himself, was a very dirty river, and he thought there were cleaner rivers in his place that he could have used, but he was asked to dip 7 times. When he followed the guideline, when he followed the prescription, he was healed. On the other hand, this man, the crippled man, in John chapter 5, verse 1 to 9, this man was waiting to get into a pool to be healed. But when Jesus passed by, when Jesus met him, instead of getting into the pool, Jesus told him, "Take up your bed and walk." The operating word there is obedience. Obedience through from Naaman, as well as obedience from the guy. He could have said, "But I cannot walk. How can you ask me to take up my bed and walk?" But he obeyed, he was, and then he was healed. Today we are asked to do things that probably we are not comfortable doing. Social distancing. We are accustomed to hug and kiss and, all of that. But today we have been asked to refrain from those things for our healing, for prevention of the spread of the infection. And when we comply, we can see the results. Though we may have all 16 cases recovered or healed, or when we do have, we cannot be complacent and let down our guard. Let us not complain, but rather let us be patient. Let us embrace the opportunities presented or provided by this pandemic. If you look for the opportunities, you will find them. But if you look or if you are bent on complaining, you will always find reasons to complain or things to complain about. Let us not despair. Let us not fear. Some we know have not fully recovered from malaria. But thank God we are here. Let us trust God, and as the songwriter says, we need to trust and obey. We cannot say we trust God, we have faith in God, and do not do those things that will help us to be better, because God honors obedience. Let's follow the guidelines for our health and healing. Let's look out for each other, especially the most vulnerable among us. Let's remain socially connected while maintaining physical distancing. Let's hold on a little longer. There is light beyond the tunnel, and that was said by a previous presenter. Together, we can come out of this stronger than we got in. There is a statement by Ellen G. White, one of our authors, in the book Counsels to the Church. She said, "We have nothing to fear for the future, except as we shall forget the way the Lord led us and his teaching in our past history." When we consider how God has seen us through, past Erica, past Maria, and for those of us who have been here a little longer, past David, and we are here today, we have no reason to fear. I leave with you 10 tips for creating normalcy at home during the lockdown, shared by Dr. Patricia Hodgson Henry, a clinical psychologist who did a session with us. Because some people at home seems, when is this going to end? But it will soon end. But in the meantime, number one, create a schedule. Don't just let things go anyhow. Create a schedule. That will help to give you some stability. Smile. And we are told that the brain doesn't differentiate between a fake smile and a real smile. So smile anyway. Number 3, minimize and filter information. We have heard about that quite a lot. Stop listening to all the different channels and all the news and all the videos that come to you. You know, you need to filter those things, because too many of them, it really creates anxiety. Have fun. Enjoy your family. Enjoy the opportunities that you have to be home, and probably do something creative that you probably did not think of doing or did not have time to do before. Take care of your body. And you know, I cannot overemphasize that. Boost your immune system. Exercise. Even if you cannot go to do the usual place you went to exercise, stay active. There are indoor exercises, but there are also outdoor exercises, because you need sunlight. You need sunlight for vitamin D. You need fresh air. So don't stay inside and sit and eat and get obese. Then your blood pressure will be higher. You can get heart attack. You may not get COVID, but you can get heart attack. You can get a stroke. You can develop diabetes. So don't sit inside the house and just open the fridge, keep opening the fridge and keep eating. Have a regular, your meal, eat healthy. And I usually say, to eat healthy, you must shop healthy. So when you go to shop, buy or purchase those things that will help you to maintain your health and well-being. Also, rest. Get adequate rest. That is very important. Connect with others. And again, we need to emphasize staying connected with family, friends. Even those overseas, you can connect with them. Manage stress early. If you notice that some things you seem not to be sleeping well, and no matter what, you're not sleeping well, then get help. Call somebody. Have somebody that you know you can rely on, that you can call and talk to in the event that you're having difficulties. Also, you need to care, be grateful. Gratitude is very important. Be thankful. Again, as I said, complain less and look for something to be thankful for. God is good. You usually say all the time, God is good. And think of how He has seen you through in the past and use this as a buffer, as a means to help you to go through this. And of course, you need to pray. God still answers prayers, and He answers prayers today. He may not answer in the way that you want, but if you believe in Him and if you rely on Him, you know that He always comes through. He's always on time. And I know because we are home quite often, and especially students as well, and we are doing a lot of online stuff and computer stuff and phone stuff, our eyes. So we need to have proper eye care, and Dr. Shillingford Ricketts sent out some information on maintaining healthy eyes. I think this is something that we really need to pay attention to. Thank you and for having us here this evening, and I just trust that all of us will continue to give God thanks for what He is doing, what He's able to do, and what He will do in, for, and through us. May God bless you all.
And special thanks to Priscilla Prevost, who is the health coordinator of the East Caribbean Conference of Seventh-day Adventists. Like I said before her presentation, she wears many hats. We see her as a medical expert. We see her as a spiritual counselor as well. So we thank you very much for that presentation. And finally, this evening, we welcome to address us the national epidemiologist, Dr. Shaluddin Ahmed.
Honorable Dr. Arvind McIntyre, Minister of Health, Wellness and New Health Investment, Mrs. Letitia Lester Dwight, Permanent Secretary of Health, Wellness and New Health Investment, Mrs. Janice Jajak, Director of Dominica Social Security, Mrs. Priscilla Prevost, Health Coordinator, East Caribbean Conference of Seventh-day Adventists. Pleasant evening to everyone. The number of confirmed COVID cases remain at 16. And so, here are the details of these cases. Of them, only 3 were linked to external sources. That is, 2 of them had a travel history, and 1 had contact with a group of tourists. The remaining 13 were contacts of the 2 cases from La Roche and Concord. As such, the formation of these clusters. Their ages range from 18 to 84 years, and with the median age of 52 years. Of these cases, 11 are males and 5 are females. Only 4 out of 16 exhibited symptoms prior to their diagnosis. 2 of these 4 were in home quarantine, and the other 2 reported through our healthcare facilities. Symptoms were mostly mild, that is to say, 3 had fever, 1 had shortness of breath in addition to fever, 1 had diarrhea, and 1 person only had loss of smell and taste. The rest of the 12 were asymptomatic, detected through contact tracing. 6 of those 16 cases had chronic underlying medical conditions, that is, diabetes and hypertension mostly. All 16 cases were isolated from the community at the point of diagnosis and have been monitored and managed over a period of 14 days at least. As of today, all were discharged following due procedures except 3. Further assessment will be done for the remaining 3 at the end of this week. None of them required use of any mechanical ventilator, and there have been no fatalities to date. So just to highlight some points, following points. In our scenario, 75% of those cases are asymptomatic. Based on our contact tracing data, the range of R0, in another word, reproduction rate of this virus, is between 1.08 to 2.43%. That means in Dominica, COVID-19 can be transmitted from one infected individual to more than 2 other healthy individuals. The majority of those who had symptoms had fever, shortness of breath, diarrhea, and loss of smell and taste. So these are the predominant clinical presentation for COVID cases. The current transmission is still in the form of cluster of cases. As of today, the total number of contacts remain the same, 152. Of these contacts, 12 were positive and the rest were negative. Additionally, some of these negative contacts were under quarantine for 14 days at the government quarantine facility in order to ensure maximum precaution. A total of 386 individuals have been tested for COVID-19 using PCR method in our lab. Of these 386, 370 were negative. And 21 days have passed since the last confirmed case was detected. Henceforth, the Ministry of Health will begin a community-based survey which will be implemented from the May 5th for the period of 1 month. The objectives of this survey include the detection of asymptomatic carriers and the determination of the extent of the infection in the general population. This survey will be conducted on the randomly selected proportion of households from all 7 health districts. The survey will be initiated in the high-risk areas first, namely La Plaine and Marigot Health District. The date, May 5th, will give us 2 full incubation cycles since the detection of the last confirmed case. By such time, antibodies to this virus will be fully developed, and thus the timing of this survey to check antibody level vis-a-vis extent of the community transmission will be very valuable. All necessary preparation for this survey are on track. Ultimately, this survey will pave the way for an evidence-based exit strategy for this current state of emergency situation in Dominica. Finally, I want to remind everyone that we, the Minister of Health, and the government by extension, are doing all that is humanly possible to control the spread of this virus in Dominica. So now you need to continue to practice the good hand hygiene, respiratory etiquette, social and physical distancing, including all my previous presenters that presented and shown you a way how to do those proper hand hygiene, how to do respiratory etiquette, and how to social distance yourself where it's not necessary. So with this, I thank you and good night.
And thank you so much, Dr. Ahmed. You continue to do a stellar job at the surveillance and, of course, the contact tracing that helps us so much in Dominica to stay safe. This evening, I'd like to thank a few stakeholders who have come on board to offer support and assistance to the Ministry of Health, namely the International Organization on Migration, the IOM, and Signman, 2 of our newest partners. And I'd also like to extend thanks to the Pan American Health Organization. From the onset, they have been with us, providing us with resources that we can use, whether it be training or even the items that we might need, PPEs for our healthcare workers. So once again, we'd like to thank PAHU for their contribution. 3 weeks since our last positive test. That is nothing to laugh at. I would like to congratulate the Dominican public, the Ministry of Health, and every partner, because in one way or another, you have played your part in keeping the numbers down in Dominica. Ladies and gentlemen, as always, we thank you for your attention, we thank you for your patience, and we thank you for your time. Have a good evening.